All right, everybody, it's your chance to ask questions of our pet doctor about your pet's health. And this morning we have Dr. Jerome Williams, who is a regular with us, of course, and the number to call is 741-7474 to ask your questions of Dr. Williams. We have 3 callers on the line already. Good morning. Let's check in now with Tuesday from Hueytown. Good morning.
Good morning.
What's your question for Dr. Williams?
I have a baby Shih Tzu. She's a special needs baby. She was born with one eye.
Oh, wow.
And I'm just wondering if the one eye she has, if she's going to have problems seeing out of it.
What I would suggest, Lynn, is have her examined by one of the 3 ophthalmologists that we have in Birmingham. And that way they can assess the quality of the vision of that eye and the potential of any other problems. But I definitely want to have her ask your veterinarian to refer you to have an evaluation done.
Okay.
All right, Tuesday, I hope that helps you. Shih Tzus are such wonderful dogs.
Yeah, they are.
So we wish you much success with that dog. All right, let's check in with our next caller, who is Carol. Carol, good morning.
Good morning.
Where are you from, Carol?
Jacksonville.
All right, what's your question for Dr. Williams?
I have a husky mixed dog who's constantly licking the air, like she's thirsty or has a hair in her mouth, but she doesn't. And at one time her tongue was slimy, but it's not slimy anymore. And then a second question, she has arthritis, and can I give her my osteobiflex instead of dog glucosamine?
I'm not certain about that. Now, aspirins work very, very well in dogs, and the coated or the buffered aspirins are quite safe. And we've got many other good arthritic medications out there. I'm not certain about yours. I don't know enough about it to be able to speak on it intelligently. As far as licking the air, I'm not certain what that's about, whether it's a dry mouth or what's going on there. I'm just not certain. If it's dry mouth, there are products around like Biotine that can make a big difference. But I'm just not certain what's causing that.
Okay. All right. Thank you.
Take it to your local vet, and maybe they can do some extensive, a lot of times when you can't examine the dog, you can't really make a diagnosis.
Right, and there's some natural products you can use for arthritis. Vitamin E and selenium in the right ratio works well, and aminoglycin or glycoaminosin. Both of those natural products, when used in combination, are very, very effective against arthritis. Okay,
good information there. Okay, I hope that helps you. All right, let's go to Kathy from Birmingham. Good morning. Kathy, are you there?
Hi, Kathy.
Kathy,
Hi.
Good morning. What's your question?
I have a schnauzer, miniature schnauzer, and he's developed some drainage in his eyes, and I just got 2 rat terriers, and I'm wondering if he has gotten something from them.
It's highly possible. Is the drainage clear or yellowish looking or greenish looking?
It's yellowish.
That would point toward an infection. It's something that needs to be seen and probably can be treated successfully. Now we're getting into the allergy season also, so allergies can preclude the infections occurring in our eyes. We're seeing it in individual people as well.
So what kinds of, what would cause that? Is that they're allergic to a lot of things, right?
A lot of things, and environmental changes that are occurring now with spring upon us. So many of the elements out there, the things out there that we see in the spring can precipitate that. Okay,
Kathy, I hope that helps you.
Okay, thank you so much.
All right, we have more calls out there. Sharon from Homewood, good morning. Good morning, Sharon.
Yes, how are you?
We're great. How are you today? What's your question?
Well, I've got a lab that's almost 15 years old, and a couple of weeks ago, she really started losing weight fast and looking kind of lethargic.
Wow.
And I was, thinking, well, she just doesn't have much longer. And then she passed this big glob of worm. I called the vet, and he said it was tapeworm. And I said, but she's on heartworm medicine. And he told me that heartworm medicine does not take care of tapeworms. So mainly I just wanted to point that out to people that they still need to worm their animals.
Yeah, now tapeworms are caused by fleas.
Yes,
and we'll get into that season again. Yes, but if you've got an older dog, 15, I would suggest, if your veterinarian has not, having them do some extensive blood work, because at that age, organs are beginning to change, and there may be some metabolic changes occurring in the major organs like the kidney and the liver and the heart at this age. So, and if you identify quickly enough, there are things you can do to extend the life and the quality of life.
Yeah, well, she has you know, we live out on a lot of land, and she stays close to the house, but she does have a partner, and they're inseparable. But she just smiles all the time. She's happy. She's a little stiff in the hips, but I, you know, give her something for that.
Right, right. But any older dog, anytime your pet is 7, 8, 9 years old, I would suggest at least annual blood work to see the quality of health, the state of health of the animal, and ideally twice a year. That could make a big difference in extending the life of your pet.
Okay, thank you.
Well, thank you for calling, and thanks to all of those who called in with their questions. Oh, a Labrador that's 15 years old, that's kind of rare, isn't it?
Yeah,
Wow.
yep, absolutely. She's done a whole lot of right.
Okay, well, thank you again to our callers, and thanks